it is inevitable that all of us will over time age and that all of us will over time develop health issues. That is inevitable. You can exercise and look after yourself, but life also happens. So there are a number of things that we ask about. So I often ask about 4 important things. Do you feel short of breath? Do you feel palpitations? So a sensation that your heart beats away either really rapidly or otherwise perhaps more irregularly. The third thing I always ask about is whether you felt that you've had swelling or that you have become overloaded in terms of fluid. And then the fourth question that I often ask is whether patients have chest pain. And chest pain is the classic presentation when there are narrowings in the blood vessel that supply the heart muscle. And where one has angina or chest pain, we're often nervous about that. The problem is that those 4 things don't always classically, easily come in rhythm or come with time or present in a typical way. There are numerous atypical, out of the ordinary presentations. I often ask patients whether they think that they have aged. If a patient tells me I have aged 2 years in the last 2 years, I say that's great, that's how it should be. Because all of us experience that we're not as strong as we were when we were 22. I get really alarmed, and I think patients should sit up when they feel that they've aged 10 years in the last 6 months. So often if you scratch in the story, they will tell you that there have been warning signs to suggest that they're just a little bit limited, they're just a little bit off, they just haven't gained fitness in the same extent, and that they've recently found that they are more prone to any of those symptoms. Then I sit up and I think that additional investigations are necessary.